Approximately 19 million adults are affected by some form of phobia. Most of us are familiar with claustrophobia, a fear of being confined, or arachnophobia, which is a fear of spiders. But most of us have never heard of one of the most common phobias of all, glossophobia. Psychiatrist Dr. Joshua Weiner is here to tell us more about that and what to do about it. Doc, thanks for coming in today.
Sure, of course.
So what is this glossophobia and what do you do about it?
All right, so glossophobia is the fear of public speaking. Very common. They've done surveys. They found that this is the #1 fear that people have, even more than death.
Wow.
So when people say, I'm scared to death of speaking, you know, they're not exaggerating. So this is incredibly common. Now, for a lot of people, it's just a little bit of anxiety. You get a little shaky. Maybe your voice is quivering a little bit, dry mouth. But for some people, and I've seen these in my practice, it is you're failing classes. You refuse to do that public presentation at the end of the class. Debilitating. So this is a real problem. There are things that people can do about it.
So, but what is it about public speaking that creates so much anxiety and fear in some cases?
Well, I think it all boils down to just all the focus being on you, and you just worry that you're going to make a fool out of yourself, that people are going to sense that you're nervous or that you're going to screw up, and there are going to be a lot of eyes watching. That's really what it boils down to for the most part.
So what do you do about it then? Are there sort of behavioral techniques that people can try to adopt? And you hear about picture everybody naked in the crowd, that sort of thing.
Yeah.
What do you do to try to deal with that fear?
Okay, so a few things that you could do. One is if you really have to do some public speaking for your job and this is a real problem, then I suggest you do something like Toastmasters. So these are classes that you could take. They teach you how to do public speaking. You get a lot of practice with it. Ultimately, what any anxiety disorder boils down to is you must expose yourself to that which you're anxious about. So if you force yourself over and over, day after day, to do some form of public speaking, eventually your brain is going to get the message that this is not something that you have to be terrified of. For other people who are just having to do these speaking every once in a while, it's going to be more things like recognizing that everybody is nervous, so you're not the only one. Or maybe you just say to everybody, hey, I'm not much of a public speaker. I have this stuff called glossophobia, something like that, make a joke out of it. People are then rooting for you. These are sort of the things that you want to do. Practice, 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 practice in front of a mirror, but there's no sort of magic answer.
So, but you say you do see patients who have to deal with this glossophobia. Are there then medications that might help if you have a more extreme form?
So there's a medication that I think works wonderfully. It's called propranolol. It's a beta blocker. This is a blood pressure medicine. A lot of performers will use these for concerts, etc. So this medication, it works very quickly. So you take it low dose. So the dose that's used to treat blood pressure is hundreds of milligrams. The dose to help with this is tens of milligrams. So you take it about 20 minutes before the time that you have to give your presentation, and it kicks in, and the effects wear off about 6 hours later. Doesn't cause any physical dependence, doesn't get you high, doesn't make your thinking cloudy like some other medications that are sometimes used for anxiety do. So it's a very helpful medication, particularly for as-needed use.
Okay, so not a daily thing. You just take it right before your presentation, and you should be good to go.
Exactly. Now, of course, you're going to want to try it at home a few times before you go out and do it for the first time, because you have to adjust the dose potentially. But yes, exactly. It's as needed just when you have those speeches.
But start out with exercising some of those techniques. Try to get used to it before you maybe turn to something like that.
Absolutely. I mean, it's always better to turn to other things besides medication, but if you really need to, this is here, very helpful.
All right, glossophobia. We have a name for it now.
All right.
Dr. Weiner, thanks a lot.
Take care.